Good morning and welcome to those joining from the United States, Brazil, and around the world to yet another, we're almost up to 160 Woodrow Wilson deep dive into how each region of the world is responding to the COVID-19 pandemic. Not all 160 are this issue, but we have been doing deep dives mainly on this issue recently. And our ability to do this with the best and smartest people in the world is the reason why we have been named #1 in the world for 3 years in a row by our peers for regional expertise. I'm Jane Harmon. I'm very proud to be President and CEO of the Wilson Center. I'm a former member of the United States Congress. And today we are zooming in, no pun intended, to Brazil, which is confronting the largest coronavirus outbreak in Latin America. The official count is over 60,000 cases and over 4,000 deaths. But experts fear that the real toll of the disease is much higher. That may be true in the United States as well. Brazil's challenge is compounded by the country's stark economic and social inequality. Densely populated urban communities make social distancing a complicated endeavor at best and impossible at worst. Around a quarter of Brazilians live in poverty, and many more lack the resources to survive weeks or perhaps months without income. Unfortunately, Brazil's president, Jair Bolsonaro, has described COVID-19 as just a, quote, measly cold, and the political turmoil has escalated after the resignation Friday of Justice Minister Sergio Moro. Brazil's constitution guarantees the right to health care. But this is much easier said than done. And in Brazil, we are seeing healthcare systems and hospitals overwhelmed, just as in many other countries, just as in our New York City system was so overwhelmed just a few weeks ago. At the same time, with Europe tentatively emerging from lockdown and some US states close behind, countries around the world are clamoring to restart their economies. As you will learn from our panelists, Brazil is in the thick of the debate about how to balance the medical crisis against the economic crisis. I would just interject there that I hope the goal is to have both healthcare and an economy. It seems to me impossible to have one and not the other. But that would be my view. To make sense of the pandemic are people much smarter than I am about Brazil and the country's response. And we are joined today by an impressive group of experts in the areas of health, development, and economics. Later on in the event, we will hear from Margaret Del Como de Fiocruz, Miguel Lago of the Institute for Health Policy Studies, Monica De Bolle of the Peterson Institute for International Economics, and Sergio Fausto of the Fernando Enrique Cardozo Foundation. But first, it is a delight to welcome Ambassador Tom Shannon, co-chair of the Brazil Institute Advisory Council. Many of you will recognize Tom from his long and distinguished career in the U.S. Foreign Service, including as ambassador to Brazil from 2010 to 2013, and where we all worked closely with him as Undersecretary of State for Political Affairs from 2016 to 2018. When it comes to Brazil, few Americans can match the depth of understanding and commitment to building stronger ties between our two societies and governments than Tom. Tom, thank you, we love you, and to all the panelists and to all the listeners, please stay healthy and safe. And now join me in welcoming our buddy, Ambassador Tom Shannon.
Well, thank you very much, Jane. It's a great pleasure to be here today, and thank you for your extraordinary leadership of the Woodrow Wilson Center, especially during these very challenging times. As you've noted, the center has done an amazing pivot from a center of convoking and convening here in Washington to one which has been able to use technology as a platform to draw people in from all around the world. And so we're happy to have this opportunity to, under your leadership and under the leadership of Ricardo Zuniga as interim director of the Brazil Institute, and with the incredible work of Anya Prusa as the senior associate, and in memory of our dear friend and the former director, Paulo Sotero, still with us physically and spiritually, but not here on the webcast today. We are just delighted to have this chance to engage with the experts that you have noted, who have a deep understanding of public health policy, social welfare, and politics in Brazil, and who have been tracking closely over time Brazil's response to COVID-19 as it deals with political turmoil and an effort to emerge from a long-standing economic recession and begin to develop economic growth while addressing problems of transparency and corruption. And it's be an enormous challenge for any society, but it's particularly important for Brazil at this point in time, the second largest democracy in the Western Hemisphere, and like the United States, a federal system which has built into it enormous resilience and capability through governors and municipalities to address problems like COVID-19, but which, as in the United States, are struggling with a federal government and national government that has been ambivalent about facing the challenge until the reality of the challenge has broken upon it in a dramatic and frightful fashion. And we're very lucky also to have with us today Sergio Fausto, the Executive Director of the Fundação Fernando Henrique Cardoso. And I would like to turn to Sergio to begin with, to lay out the political panorama of Brazil at this point. Jane highlighted the immediacy of a crisis and the aftermath of the decision of the Minister of Justice, Sergio Moro, to resign following the president's decision to remove the head of the federal police. And as we dive into the public health aspect of this and the social consequences of Brazil's efforts to deal with COVID-19, I think it best to set the political context for this discussion that we're going to have today. So Sergio, it's with great pleasure that I turn to you. Thank you very much.
Thank you. Thank you so much for the invitation. It's a real pleasure to share the panel with colleagues and friends. And good to see you again, Tom. You look great. And we know we have a lot of admiration for you down here in Brazil. So since I have just 10 minutes to address such a complex issue, let me start. And I have one assumption and two questions that I would like to address. The assumption is that the Bolsonaro administration is facing a sort of perfect storm, partly a self-inflicted storm. The two questions are, will he survive the storm? Will he be able to serve out his term in office? And if so, what are the chances of Bolsonaro and extreme right in Brazil being reelected in the coming presidential election? Let me first acknowledge the fact that in spite of all he has said and done, that run contrary to common sense, political conventional wisdom, and science, it's incredible how resilient has been the popular backing to Bolsonaro. Polls just released in the last weeks, and especially in the days after Moro's firing from quitting the administration, they show that he still have like around 30% of the electorate of the Brazilian population that is strongly behind him no matter what. The question is the Moro affair a turning point in this trajectory, or it is just one more hit that he will be able to absorb? My gut feeling is that this time will be different. And this time will be different for basically two reasons. One is that Moro is a symbol of the anti-corruption fight in Brazil. He was the most popular member of Bolsonaro cabinet. He is linked to one of the pillars of Bolsonaro's platform, the one he ran for the presidency, the anti-corruption fight. And the anti-corruption fight against whom? Basically against the political class, the political establishment. This is the first reason why I think Moro out of the government tends to be a game changer. Second important factor, from now on we have not only a battle on the political ground, but also on the juridical ground. it should be noted that no less a man than the Attorney General. The Attorney General here in Brazil is not the same as the Attorney General in the United States. He was appointed by, the Attorney General has by statute autonomy, complete autonomy in relation to the executive branch. But he was appointed by Bolsonaro. And Bolsonaro appointed him because Bolsonaro thinks he shares basically the same kind of mindset that Bolsonaro has. Well, it was this Attorney General who has requested the Supreme Court to open an investigation to shed light on the accusations that Moro presented when he was resigning to the post of Justice Minister. So this is it is a completely different ball game from now on, because Bolsonaro will have to fight on multiple fronts. He will have to face the consequences of the pandemic here, the social economic consequences of the pandemic here, and he will have to face the juridical consequences of his acts as President of the Republic. These are investigations that are underway now in Congress and also at the Supreme Court, focusing not only members of his family, but also his supporters, and himself as head of state. This might open the doors for an impeachment process. How likely this is that an impeachment process will be opened here in Brazil, it is hard to say at the moment, but the chances had clearly increased since Moros has quit the administration. One should, when gauging the chances of an impeachment process to unfold here in Brazil, we should think about the context in which Moro was forced to resign, and his replacement is taking place. Bolsonaro's main goal now is to protect himself and his family. He's playing defense, right? That's why he needed so much that Moro was removed from the Justice Minister, because he needs the control of the federal police to curb investigation which are focusing on him and his family. So he is very much at the limelight in a very negative way. Parallel to that, the pandemic is gaining steam here, right? And I'm not a specialist, not least an epidemiologist, but all things point to the aggravation of the pandemic here, and the aggravation of the social economic consequences of the pandemic. Bolsonaro, in my view, is not responding well to these basic challenges and the trade-offs between the two basic challenges. He has entrenched himself in a very stark, in the crudest way, position that it's the economy, stupid. People will die no matter what. So all we have to be concerned about is to save jobs. So he hasn't had his backs, and he has taken a position which is simply cruelest, betting on his ability to benefit from the fact that the social economic consequences will be dire, especially among the unemployed people and the badly employed people. I think this is a too risky bet given the trajectories of the pandemic and of the social economic consequences of it. So there is a high chance that investigation and the evolution of the pandemics and the social economic consequences feed into each other to the detriment of Bolsonaro backing among the population. If that happens, the idea that he can get enough support in Congress to avoid an impeachment process, the likelihood that happens tends to decrease. In other words, seeing it from a different angle, the cost, the political cost of gathering enough votes in Congress to avoid an impeachment process will skyrocket. And Bolsonaro is not a conventional politician. He came to the presidency on a platform which is basically anti-establishment. His main flag is, I will fight until the very end, old politics. And now what? Now he's resorting to the worst kind of old politics to remain in power. And I think this will prove lethal to his popularity. And at the end of the day, that might, I would say, probably will morph into an impeachment process. How soon? It's difficult to say. This process tends to take time, and the costs in terms of economic costs, in terms of human lives in Brazil, I think will accumulate over time, because there's no easy institutional political solution to the kind of political stalemate that we're living through. Do I have still some minutes to elaborate a little more on other points?
Well, yes, you do.
But if he, let's assume for a moment that he is a smart political animal, that he will survive this perfect storm. If so, I think we can say, well, nothing can be said for sure at this point in time, but the chances that he will not be reelected have increased dramatically over the last month. And the reason behind that is that because he's losing ground among the more moderate sectors of the Brazilian right. And I think the fracture that has been split among the more moderate sectors of the Brazilian right and Bolsonaro, it cannot be easily mended. They can only be mended under two circumstances, either one or the other. One, that we arrive in 2022 growing strongly. I think Monica and other participants will show that the likelihood of the strong performance of the Brazilian economy in the coming years, I mean, it's far-fetched. The other circumstances in which he can regain ground electorally and politically speaking is that no alternative appears at the center of the political spectrum. This is a possibility given the fragmentation of the centrist forces, but compared to 2018, conditions are ripe for the appearance of leaders and leaderships, politically competitive candidates at the center of the political spectrum, and that, in my view, will prove to be a formidable obstacle, electoral obstacle for Bolsonaro to be reelected. One final word about civilian-military relationship in Brazil. The military, especially the army, are deeply entangled in this administration. They are exposed politically. It will be hard for them to disentangle the corporation from the administration. They will try to minimize that cost. That's why I think the military will wait until the very end to take a step out of the government, because the cost of abandoning Bolsonaro is high for them. At some point in time, it might turn out to be that the cost of remaining in power will be higher than the cost of disentangling themselves, but they have went too far in my view. And so do not expect the military to take a protagonist role in this process. They will operate behind the scenes. One last comment, and it is a concern. I think the civilian military relationships in Brazil has suffered a setback, a structural setback, in the wake of the political scandals of the last 5 years. The old belief prevalent among the military that civilian politicians are not reliable, and that Brazilian politics need military tutelage has regained ground. This old belief has regained ground among the military, in spite of the fact that I think they're still committed to the Constitution. But I think the chances that we might have in the future, either in the near future or in the not so distant future, a sort of hybrid administration here in which the military will have the upper hand, it's not a fantasy, and I think it should be a matter of concern for us. I think this does not, it should be a matter of concern for the armed forces as a permanent institution of the Brazilian state. I'll leave it here, and I'll be more than glad to answer any questions you might have.
Well, Sergio, thank you very much. I think you gave a fantastic description, a snapshot of the panorama that is the backdrop for this extraordinary health emergency that's impacted the entire world, but certainly Brazil in a very visible way. I would just add one point on that issue of civil-military relations. By the way, those kinds of strains are showing up in so many parts of the world as they deal with this kind of a crisis. But in Brazil, it also strikes me that not only in the military is that sentiment regaining ground, but among members of the middle class and other parts of Brazilian society who retained a very positive view of the role of the military. That's another issue that I think we're going to all have to contend with as societies, but for Brazil, it will be a special challenge as we go ahead. Sergio, thank you again. That was excellent. You know that we're going to be calling on you frequently as all of these events evolve, and just really want to appreciate your presence here, particularly on short notice. Now, we're going to hear from our other speakers who are going to focus on other elements of the crisis that Brazil is facing as a result of the spread of COVID. They're each going to offer about 5 minutes of remarks, and we'll follow that with questions for panel members. So again, if members of the audience would like to submit a question, please email us at brazil@wilsoncenter.org, brazil@wilsoncenter.org. And so to start us off, we're going to start with Dr. Margarete Del Como of the Fundação Oswaldo Cruz, Fiocruz. Welcome, Dr. Del Como. Please go ahead.
First of all, thank you so much for this invitation. I feel myself very honored to be among and to see again my new best friend from my childhood, Sergio Fausto. We met last week in another meeting, and it's an honor to be with Ambassador Thomas Shannon and Monica de Boylen and all of you. I am a researcher. I work at Fundação Oswaldo Cruz, which is the biggest foundation in terms of research and fabric for medicines and tests. And now in this, to face this epidemic, we have been working hardly in terms to provide the government and our national health system, as you know, we call SUS. It's our national health equalitarian system, that we have in Brazil. So what we have been doing, what I can remark very shortly for this audience. First of all, Brazil had his very first case of this epidemic after Carnival in late February. So it means that Brazil had actually time to prepare ourselves to face this epidemic. I gave my first interview in the early March, saying that the epidemic would come and it will hit the country heavily. Why? Because it was not a prophecy, of course. As a physician, as a researcher, we knew. I have been in Africa many times. I know epidemics. So we are used to deal with this kind of challenges. We faced the H1N1 epidemic sort of 11 years ago. I was one of the doctors that worked at this time. So we knew the size of the challenge, the size of the endeavor we had to face. And at that time, we start to discuss among some research groups. And our former minister, Dr. Luiz Henrique Mandetta, called a bunch of specialists that gathered in Brasilia in the early March. And at that time, we could establish some sort of recommendations for the country. We have stimulated the production of tests that have been produced by Fiocruz. We had at that time provided already sort of 1 million tests for the government, but we knew that it would be necessary to revise all the Brazilian recommendations in terms of how to deal with the flu, how to deal with the groups of people that would need the assistance from the national health system. And we knew at that time, it was very clear that we didn't have the ideal conditions to face the size of the challenge, which meant at that time the social inequalities in Brazil. So it was clear as crystal for all of us that for the very first time, the social inequalities will be unnaked absolutely by a health problem. And it has been more and more true throughout all these last weeks, as we can see the number of patients that are dying, the number of cases that we are facing, and the lack of responses that we should have been providing and we are not. So this means for us that we still have challenges to respond in terms of health. So what have we been doing? I mean, the doctors, the researchers, the physicians, we have been participating in a sort of common endeavor with all the public institutions in Brazil, the private sector. For the first time, I remember, and maybe Sergio could remember this, when I gave my first interview, I said very, very clearly, I almost screamed that the private initiative should be present, but heavily. And we didn't have to have shame to speak about assistantialism, because we have a sort of shyness to speak about. We know that we have been touched by sort of prejudice in terms of to speak in assistance, to be assistentialist, but it is absolutely necessary if it is not done, and we are having some sort of help. For the first time, we are seeing banks, private banks, giving donations. This word, donation, which is very common in United States culture, is something that sounds strange for us up to now. But now we are seeing something really new, which I would like to point out and to remark in this first, I would say, introduction. So we are having banks making donations of tests to the Ministry of Health. We are having private good enterprises giving sort of equipments for individual protection for health professionals, giving more tests, giving respirators to the hospitals, to the named campaign hospitals that have been built up, not only in Sao Paulo and Rio, but particularly in some cities that have been heavily hit by the epidemic, like Manaus. The situations in Manaus is, I would say, very dramatic in this moment. So I would say and conclude in this first introduction, Ricardo, that we didn't do our, I would say, homework properly. We didn't do it. Why? Because we knew the response that would be needed. But two things complicated very much the response that we physicians and researchers are trying to provide to the country. First of all, the ambivalences, the absolutely inconsistencies between the formal discourse, I would say, from the federal government and this inconsistencies between federal government, the central government, and the local governments, the governors of some states, particularly São Paulo and Rio states. Our governors have been, I would say, between them, particularly Rio and Sao Paulo, working very closely in terms of recommendations and to be more strict about social isolation, social distancing. But this mess created by these ambivalences, the result, the outcome is, for me, the biggest humanitarian tragedy we have ever seen in Brazil. The number of avoidable deaths is something that we as physicians cannot accept. And so we are still working a lot for this. We are still trying to convince people. I have been in the press. Many very representative colleagues have been also present in terms to appeal for the public opinion that we have to comply with social distances. Why? Because we don't have vaccines. Vaccines will last at least 2 years. We don't have treatments. All the clinical trials up to date did not demonstrate, I would say, enough consistent information to be proven to be good, to be used in these cases. And so we have to use the only arm that we have is to comply with social distances. So this is a general overview I would like to provide you to start this discussion. And thanks for this time.
Doctor, thank you very much. Obviously, it's a dramatic moment in terms of the real impact that we're starting to see in Brazil. And given that context that you've provided of the chaos that has formed part of the picture, that confusion about federal and state responsibilities, and what the implications are from a health perspective, we certainly are going to circle back during the question period. I think it's important to get a clear understanding of what this could mean. You're describing it as the worst health crisis that Brazil has faced in its history, and it would be, I think, important for the audience to get a good picture of that. We'll circle back to you on that. Thank you so much for that panorama. And now I'd like to welcome Miguel Lago, Executive Director of the Institute for Health Policy Studies. Miguel, please go ahead.
Hello. Well, thank you. First of all, thank you so much for the Wilson Center, to Ambassador Anya, Paulo, for this wonderful invitation. It's a big honor for me to be here with brilliant Brazilian minds. And just adding a little bit on what Dr. Dalcomo and Sergio said, and moving beyond Bolsonaro's speech, and we know that political speech has an impact on people's behavior. But also we need to remember to remind that Brazil is one of the few countries in the world that changed and replaced the health minister during the crisis. And this is something that we haven't seen. We haven't seen this in Italy. We haven't seen this in Spain. We haven't seen this even in New Zealand, where the health minister violated his own policies of social distance. He was kept because of the crisis. So there's so we have it's a political chaos, of course, and that impacts a lot the way that we can deal with this crisis. But I would like to move beyond the political crisis and going to our health system. So understanding what are our structural flaws, but also our great advantages and leverages that we have in order to combat the COVID. So first of all, we have deep structural flaws in our Brazilian health system. So if we look at, especially at the supply of health services, and especially if we look at the hospital system, the public hospital system, and particularly to equipments that are necessary for the COVID. So if we look, we don't have enough ICU beds in the public system in Brazil as an average of ICU beds or respirators. And when we look regionally, it's even more scarier, because you have some regions where you have enough respirators and ICU beds, or the minimum that is required to respond and to address the already existing demands for healthcare. But also, if we look at other parts of Brazil, if we look, for instance, 10% of the Brazilian population lives in regions where they don't have one single ICU bed or respirator. So, and when we look at what is required as a minimum for normal epidemiological conditions, so without looking at the crisis of the COVID, we can say that 56% of the population lives in regions where they don't have enough equipment for that. But at the same time, the same health system is perhaps what can lead us out of the crisis and help us to fight this crisis very well. Because Brazil has an amazing health system with many problems, as I stated, but at the same time is the only country with more than 100 million people in the world that offers free health care and free health services for all, which is absolutely amazing. And Brazil has the biggest primary health program in the world, that is Saúde da Família, where we have 60% of the population that is constantly enrolled in this program. So we can use this amazing leverage that we have, that many developing countries do not have, many developed countries do not have, to use them and to compensate for the lack of testing in order to identify the symptoms of the population and also doing contact tracing. What is amazing about the primary health care system in Brazil and program in Brazil is that we have community health workers that live in their own communities. So they can be absolutely strategical agents in order to fight the COVID among the population. So I think that Brazil has deep structural flaws when we look at the hospital, public hospital system. At the same time, when we look at the whole system, it gives me a lot of hope that we can fight this. But of course, this will require a little bit more of alignment between the federal government and the local governments, and especially it will require to have a president that is not saying what Bolsonaro is saying. So that's it.
Miguel, thank you very much. I think that is something that perhaps those who don't follow Brazil as well, having lived in Brazil, one of the things I found extraordinary was the prevalence of these facilities and vaccine facilities and access across the country, really. And the vaccine delivery system, I saw it in operation when there was a yellow fever outbreak in southeastern, that affected southeastern Brazil. It really is a system that's designed to, given the right conditions, to operate very quickly. And it is an enormous asset. As you said, there are other systemic issues at play as well that present a problem, not just for Brazil, but for so many other parts of the world. Now, in terms of that system and those conditions in that context, Monica de Bol is going to speak to us from the Peterson Institute regarding the economic conditions, which are, of course, as for so much of the rest of the world, the other major concern, not just for governments, but for the populations themselves. Monica, please go ahead.
Thank you. Thank you, Ricardo. Thank you, Tom. It's a pleasure to be here with you. Thank you to the Brazil Institute and to the Wilson Center. I'd like to, say hello to my colleagues on the panel, to Sergio, to Dr. Dalcoma. It's a pleasure to be on the panel with you. I've seen many of your interviews. And Miguel, it's a pleasure to be on a panel with you again and reconnect here. So I think just picking up on some of the things that my colleagues have said, and in particular, Miguel's last point on the capacity that Brazil actually has to respond. This is something that often goes relatively unnoticed by those who are not as familiar with Brazil. And I think it's a crucial point to underscore, because in the current circumstances, we really are, not using the opportunity in the way that we should. Health resources, or the resources that have been directed to the Ministry of Health, are not reaching the municipalities and the localities across the country in the way that they should. We have evidence of that. We have the data to follow, and it's a question mark as to whether that's not why that's not happening when it should be. And of course, that puts the system at even great risk, and in a terrible situation where the capacity is there to be used. The economy more generally, in Brazil there has been a lot, and it continues to sort of fluctuate, but there has been this debate over, whether you should prioritize health or prioritize the economy, which is something that we've heard in other places. In Brazil, of course, this has, as my colleagues on the panel have said, has been echoed and continues to be echoed by the president. I align myself completely with what Dr. Dal Como has said. There is no such thing as separating health from the economy. Ultimately, these two things go together, and ultimately one impacts the other, whether you're deciding not to pay attention to the epidemic and its consequences, or you are, the economic impacts will be there. And I will say that they will probably be way worse if we just let things go, which is the way by which we seem to be moving right now. The economy, of course, is not in a good place. It hasn't been in a good place for a while. Brazil has had 3 years of very sort of slow, lackluster growth. We came into this crisis with very high levels of unemployment. The fiscal situation in Brazil was starting to be put on track, but it's still was still relatively weak. But then, we got hit by this epidemic, and there was a very slow shift. There was a very slow shift in perception on the part of the government, and in particular on the part of the Minister of the Economy, in terms of really perceiving the magnitude and the extent of this crisis. So if we go back to like early March, by early March, as Dr. Dal Como has already said, we had cases of COVID and identified cases of COVID in Brazil. And at that point, the economy minister was still talking about reforms. And in fact, a lot of the other economists in Brazil were on the same too. They were talking about structural reforms. They kept on hitting that note and talking about that, when it was really obvious that the discussion needed to change completely. It was obvious that the discussion needed to focus on, getting the resources to the health system, getting protection for the vulnerable population. So Dr. Dal Como mentioned this in the context of a humanitarian crisis, and I fully agree with her. It's a humanitarian crisis on the health front, and it's a humanitarian crisis on the economic front. Brazil has about 60% of its population that we can call vulnerable. These are people that are either in the informal labor market, or are self-employed, or earn very little income. And these are precisely the people that we needed to protect if we were going to put strict sanitary measures in place. And even if we were not, because these are the people who live in the kinds of communities or somewhere in the country where they don't have access or immediate hospital access or access to an ICU unit. So we needed to get to them some means of protection. And that was a very sort of good initiative that came on the back of civil society's involvement with Congress and the push for the institution of an emergency basic income. Brazil has taken that step. No other Latin American country has done anything similar. The program's in place. It's a program that gives families a monthly stipend that is of about $110 a month. It's 3 times higher than the benefit of those who earned Bolsa Familia, and everybody who earned Bolsa Familia is eligible to receive this benefit. It also encompasses a lot of other people who fall under this vulnerable category. This is a program that is being executed now. There have been issues with the logistics and with the actual execution of the program, but it is a program to be praised because it is really what is needed at the moment to contain, the immediate economic impact on so many people and to allow them to stay home to the extent that they can. The economy, of course, now turning to the points that Sergio mentioned, obviously, we have an epidemic, we have an economic crisis, and we have now a political crisis, which might become a constitutional crisis depending on how things evolve. So bottom line is that these things combined will have a huge impact on GDP and employment. My colleagues in Brazil are still moving slowly towards the perception that this is a once in a lifetime type of crisis. We have never seen anything like it. In terms of the drop in GDP that we're likely to see happen, doing some back of the envelope calculations, because that's the best we can do in this crisis since we've never seen it before. There's nothing to go by. So there's no sort of past reference point that we can use to say, oh, you know, this happened then, so it might be similar now in this way or that way. We can't use that. We have no parameters. We have nothing to use from the past. So we have to go by what we see. And what we see is already a very sharp drop in demand, a very sharp drop in incomes. Obviously, there are already a lot of people who are being laid off and falling into either informality or unemployment. And with that in mind, you know, what we are likely to see in the context of now a political constitutional crisis is an unprecedented drop in GDP. We had a recession back in 2015 and 2016 that was already extremely sizable. So over those 2 years, so those 2 years combined, we had a drop of GDP of about 8%. We are likely to see all of that effect and then some in 1 year alone. So my current sort of best guess as to what might happen to GDP this year is a contraction of about 9%, and it could be worse than that. And if we try to translate that into unemployment numbers, we were at a position where unemployment was at 11.2, 11.3% coming into this crisis. With a drop of GDP of that magnitude, we're easily talking about unemployment rates that are going to reach 20% or perhaps, you know, something above that. So it's a very dramatic situation, as it is elsewhere in other parts of the world. It's a situation that you know, we have the policies and the economic policies to try to contain the worst of the fallout. But differently from what happened in 2008, when the crisis was economic in nature or financial in nature, this is a public health crisis, and therefore the economic measures are limited in their capacity to address the economic fallout that is inevitably going to happen. So even if the government were up to speed, and it's not, it is lagging in its response to both the health crisis as well as the economic crisis, even if the government were up to speed, we would still possibly be facing a scenario in Brazil, as other countries are facing elsewhere, of, you know, being on the brink of a depression and on the brink of a deflationary type situation, something that we have never seen before. Brazil is a pro when it comes to inflation and hyperinflation. We've had many of those in the past, but we have never faced a deflationary scenario, and that is the scenario that we're looking at now. So I'll wrap up my remarks here and just reinstate what I said at the beginning. There is no way to separate the public health problem from the economic problem. They're intertwined, and they should be treated like that.
Monica, thank you so much. And as much as we know and see and read in the media about the nature of the economic crisis, it's very sobering to see, hear those numbers and understand what that means in social terms in Brazil. And I think that's going to be a very fruitful part of this discussion. It's obviously alarming to anyone who follows Brazil, and an extraordinary shift, as you mentioned, over such a short period of time. That's the other factor at play. So thank you very much. We're going to now move to the period of questions for our panelists this morning, this afternoon in Brazil. Thank you again so much for participating. Remember, if you'd like to submit a question, please email brazil@wilsoncenter.org. Our first question, though, is going to come from Jane Harmon, who launched this at the beginning. Thank you. Jane, please go ahead.
Well, thank you. Can people hear me? Am I?
Yes.
It worked. I'm always amazed that anything I do technologically can work. First of all, I do want to amend my opening remarks because Tom Shannon mentioned Paulo Sotero, and everybody knows Paulo. He was an extraordinary leader of the Brazil Institute at the Wilson Center. Just because he is no longer physically at the Wilson Center every day does not mean he is gone or gone from our hearts. And as someone who comes from California, there's this old story about the Hotel California, which is you can come anytime you want, but you can never leave. So this does apply to our friend who put our Brazil Institute on the map, Paulo. Paulo, we miss you. So my question is, listening to this could have been a conversation about the United States. A leader who doesn't, at least at the moment, take the crisis as seriously as most people do. A lot of confusion, a structure of government that has a federal level and then a state level, not identical to ours, but similar. And so that's my question. I mean, you were all talking about it. And maybe it will offer guidance to those of us currently, as I am in Washington, D.C., hoping that our federal government becomes more muscular. Am I right that our two systems of government are mirror images, and that many of our problems are mirror images between Brazil and the US? And maybe, am I right that Brazil is the other country in the world that has the structure I'm talking about? And so it's not an accident that we have these smart people talking about the stresses there, and a lot of things that Americans on the line could learn from them.
Who would like to take that?
I may try to answer, because I really think pretty much along the same lines. I think there's no other country more similar to Brazil, politically, socially, sometimes demographically speaking, than the US. The big difference is the US is much, much, much richer than we are. And so that makes a difference. When you have more fiscal room to spend, when your currency is the dollar, so our room of maneuver in economic terms is much, much narrower than the US. On the other hand, I think there is one advantage from Brazil in comparison to the US, which is the fact that now we have built a nationwide health system that allow us to coordinate policies among the federal, the state, and the local levels. But when I try to forecast how the pandemic will evolve in Brazil, I have to confess that I look at the U.S. and because the patterns are similar in terms of urban concentrations, social inequalities, it's no surprise for a Brazilian that the disease is affecting disproportionately Blacks and Latinos in the U.S. We can relate to that reality here in Brazil. One last remark, and that is that Bolsonaro intentionally tends to mimic President Trump. My point is that he is not, he's less talented, and his menu of options, his ability to hedge his bets, he's a more pedestrian kind of right-wing politician when compared to President Trump. Not that I'm a big fan of President Trump, as everybody knows.
Margarete, I think you had wanted to add to this response. Thank you, Sergio.
I would like to point out two important things from my point of view, Ricardo. The first of them is that the pandemic in Brazil took another, I would say, profile. I said some weeks ago that we are going to have, differently from the European countries, a sort of a younger pandemic in Brazil, because our population is not made with mainly with old people like Italy and Spain. And these younger populations is exactly what Monica de Boll just mentioned, is related to this sort of 40 or 50% of informal economy. So the pandemic now is reaching the communities. Only in Rio de Janeiro, we have 2 million people living in communities, very poor areas. And these these areas, for this area and for the rest of the country, I could say this without the fear of to be wrong, we have the response, and our response should be the national health system, because its capillarity is the only way we have to assist these people. So we have these two phenomena that we have to take into account. So we have a younger epidemic. We are killing our younger people. We are not killing our old and elder citizens in Brazil. And this is something that has to be figured out for all of the audience of this panel. So thank you so much.
Doctor, thank you so much. Anya, I'm sure that there are questions in the queue. I wanted to ask Doctor and you and Miguel, if you could just to add a little bit more context to the discussion. Monica described some of the potential very negative outcomes for this year on the economic side. Doctor, I wonder if you could provide a little more detail on the potential. You just described communities that are very much at risk and present very dangerous conditions from the perspective of this virus. In terms of the health system, what do you see as the greatest potential risk in terms of impact on the population? If perhaps you and Miguel could take a chance to answer that one. Thank you. And then after that, we'll turn Anya to questions that are in the queue.
Is Miguel responding or me?
Why don't we start with you, Doctor?
Okay, so as I said, Ricardo, we have the response. We have the response in the capillarity of the national health system. So if it has been, I would say, properly treated, but it is not. So the level of dismantlement of the I would say the lowest level, exactly this capillarity, particularly in this peripheral areas of the large cities in Brazil. So the clínicas da família, the family clinics, which had been a very, I would say, creative way to provide primary assistance to these communities, were almost completely dismantled in many of our cities. So now we are running against time, and we are running in a sort of chaotic way. So we are providing help to these communities, but it is not enough. So we lost, I would say, as a physician, as a researcher, that we lost the timing, the correct timing that it had been offered to us, because we had to learn with the countries that preceded Brazil in this epidemic. We should have learned more, and we didn't. Of course, we gathered, called by a panel of specialists and researchers and epidemiologists in early March. But unfortunately, this sort of recommendation were not followed in a proper way, I would say. So we had theoretically, we have the response, and the response for the most of our population and for the pandemic, for the epidemic in Brazil, is the national health system. But for this, we'll have to work in, I would say, all the way running against time again. So this is something very frustrating for us, because we are very committed since the very first case, since the epidemic arrived in Brazil, because we knew that it will reach the country and hit the country heavily, as it has been doing up to date.
Thank you. I think Miguel and Monica are both going to add on this point. Miguel, go ahead.
Yeah, I agree totally with Dr. Dacomo. What I would add is that first of all, we need to expand our hospital capacity, especially in the public sector, and we're not doing that enough. But even if we expand it a lot, we need to control the contagion. So basically, if we don't enforce our social distancing policies, and which is not the case, not at all at the federal government, some local governments are already that did a good job in the last weeks are now relaxing a little bit on those policies. So yeah, so what we can forecast is like a disaster in terms of collapse, hospital collapse in the public system, and perhaps the private system as well. So, but especially the public system, that is the one that worries me the more. And I totally agree with Dr. Dalcomo. I think the major leverage, and I think this is and I agree with Sergio, I think the two differences with the United States are that the United States are way richer than us. So in terms of equipment, if the United States do not have enough equipment, they can always go and buy from the rest of the world, which is not the same case as Brazil, as we have been seeing in the last weeks. And we do have a very popular public health system, universal health system. So yeah, I think it's essential that the primary healthcare to be more supported and more and stronger in order to. I think it's our best option in order to enforce those social distancing policies when we have our leaders that are not enforcing it as well. I would like only to remind that Brazil regionally is doing a worse job than our neighbors. I mean, Peru, Argentina, all countries, even Venezuela, perhaps not Mexico and Nicaragua, but the rest of the region is taking it much more seriously, this crisis than we are doing, than our national and our local governments are doing. So Brazil has always related and compared itself with the United States and Europe, but it's certainly in this crisis behaving in a much less civilized way as all our neighbors.
Thank you, Miguel. Monica, go ahead.
Thank you. So just to add something on the economic implications of what Dr. Dalcomo mentioned, she mentioned a young epidemic, and she mentioned, the people that are being hit and are being affected are precisely young people that live in these communities. And unfortunately, there seems to be a perception that you can't do social distancing in favelas. And yes, they're densely agglomerated. They're, places where people live in very close proximity. But while all of that may be true, and Dr. Dalcomo, you can correct me if I'm saying something that is not true. The sense is, including from past experiences in Brazil with other types of infectious diseases, that it is actually possible to implement these measures in the communities, in the peripheral communities, in the favelas. And if this is not taken into account correctly, the kind of toll that we're taking on the economy by disregarding that dimension is huge, because we're putting young people's lives at risk. These are exactly the people that would be entering or are already in the labor force in some capacity. And that will have massive implications for the country going forward, including the country's ability to get out of this crisis once the acute phase of the epidemic has passed and we enter the chronic phase, because I think we all agree that we're moving from acute to chronic. We're not moving from acute to disappearance. And therefore, with that in mind, we need to protect the young, and we need to protect these people who are, already in the labor force or the future of the labor force, because that has huge economic implications for the country going forward.
Thank you, Monica. We're going to turn now to some of the questions from our audience. There was mention, Dr. Dalcomo, you mentioned public-private partnerships. And we know Brazil has a large public healthcare system, but it also has one of the largest private healthcare systems in the world. Are there areas for partnership? And on that point, perhaps Tom or Sergio, you could speak to, are there areas for partnership between Brazil and the United States on the healthcare front, but on other fronts as well during this crisis?
Well, I will start responding for the first part of your question. Yes, for the first time, we are having strong participation from the private sector. To provide you a practical example, one of the most important campaign hospital in Rio de Janeiro with 200 beds, of which 180 for intensive care unit, has been provided by the Rede D'Or, which is a very strong private sectors of hospitals in Brazil, a national-wide enterprise. And so it has been just inaugurated and it is already functioning. And it has been run by the private sector, but obeying to the regulation of the public health. So it's very, I would say, correctly done, I would say. So the public sector, for the other hand, by the other hand, is providing other, I would say, campaign hospitals that certainly will need participation of the private sector as well, for them to work in a proper way and to respond to the size of the challenge.
Thank
Monica?
you. And then on the question of further cooperation, Brazil-US, is there space for that? We know obviously Trump and Bolsonaro have a good relationship, but where do things stand right now?
I would very quickly argue that there's a lot of space. There's been enormous U.S. investment and presence in Brazil over the past decade, both in medical services, medical devices, bio and life science companies, and pharmaceutical companies or pharmacies. And this creates a connectivity that is really unique at least between North America and South America. And I would think that this would create a real opportunity for private-public partnership between the United States and Brazil, between our private sectors and between our public sectors. I would argue also that given the size of our societies, 300 million in the United States and 200 million in Brazil, it creates and the degree of infection, it creates an enormous bed from which to work together on vaccines and therapeutic treatments. And this is not something that should be lost.
Sergio, did you want to say anything?
May I add something in this regard?
Go ahead.
Yeah, just a footnote. I entirely agree with the things that Tom said and others said here. There's a huge potential for cooperation between the scientific community in the U.S. and the scientific community in Brazil. What worries me is the fact that recent appointments made to agencies in Brazil that are responsible for assessing scientific projects and supporting them financially are not appointments made on the basis of academic and scientific credentials, but on loyalty to the current administration. Even a man who is a believer in creationism was appointed to a key post in a key federal agency responsible for assessing and supporting scientific projects in Brazil.
Dr. Del Como, you wanted to add something?
Yes, a very short point that I would like to raise again to sort of warm up our discussion is the lack of funding for research. So US, Ambassador Thomas, you have to figure it out. So US has been a sort of a brain drainage of our researchers in these last years because of lack of funding and good funding conditions for us to work. And so this is something very sad. Of course, we have wonderful relationships between our colleagues and us, between the American groups. I do belong to several ones in US, in Boston and Boston Medical School. But you know, we are losing good people that didn't find out in this last year ideal conditions or close to ideal conditions to work. This is something that I have to point out in this discussion again. So we need to sort of profit on this very dramatic moment to sort of invest in our research groups. And I am speaking about, and I'm speaking on behalf of my institution, because Fiocruz has been a very, I would say, productive institution in Brazil.
Thank you. We have time, I think, to squeeze in maybe one more question before we need to end this. Obviously, Brazil is now starting to talk about what reopening might look like. The economic impact, as we've discussed, has been severe. Monica, what might that look like? What sort of policies do we need to see in place on the economic side to kind of keep people going until the country can reopen? And then on the health side, what do we actually need to see to feel confident that reopening is not going to make the situation worse?
Well, I'll of course leave the comments on the health front to Dr. Dal Como. I will just say that talking about reopening in Brazil right now is completely premature. The Brazilian situation is weeks behind the U.S. situation, so we are still on the steep side of the epidemiological curve. So that would be, I think, a disaster. But on the economic points and on the economic measures, I think at the very least, we need the resources that currently are sitting at the Ministry of Health to be passed on to the states and the municipalities. So the data that I mentioned and the fact that these resources are currently not reaching the localities that they need to reach. So that's one thing. The second thing is we need this emergency basic income program that we've created to actually reach the people that it needs to reach. There have been issues, logistical issues with the distribution of the benefit, but also with the registration of people who are eligible. Here, let me just point out that Brazil has this other immense capacity compared to other countries in that it has a national registry of who the vulnerable population is. There are 77 million people on this national registry, and thus a lot of them are directly identifiable. Yes, there needs to be a registration effort because there are other people who are not on this registry who are also eligible to receive the benefit, but that has to be done very fast so that people can stay in their homes. So these, I would say, are the two critical measures at this point. Then there are a number of others, to contain the increase in unemployment, getting credit to companies, especially to small and medium-sized companies, and a host of other efforts that need to be made. But health and basic income at this point, these are the critical measures to keep the system afloat, and these are the critical measures that are currently lagging.
Thank you so much, Monica. Doctor, I'm going to give the last word to you since this is a health crisis, and I think that it's important that if you could address that point about the issues related to the reopening. We have 1 minute left, and then we'll need to, unfortunately, wrap this up.
So I have been very, very, very strongly against this, because to open again, we are seeing this ambivalences resulting in a very bad outcome. So reopen now will be I would say a huger humanitarian disaster in Brazil. So we are, and I know, I am sure that I am speaking on behalf of many of my colleagues, researchers and physicians. We are strongly and clearly against reopen the commerce and reopen services in Brazil at this very moment.
Doctor, thank you. That's a very clear message. And I really want to express my appreciation for all of the presenters today, as well as for the participation of Tom Shannon in this discussion. There's much more that we could say there. And I think, number one, I think I've certainly learned quite a bit in this very fast-moving moment about the direction of events. As I mentioned earlier, it's quite sobering. It's an issue of tremendous concern, I think, for anyone who cares about Brazil and the U.S.-Brazil relationship. But as Ambassador Shannon pointed out, there are also many areas for potential collaboration. And I think that these kinds of conversations are very helpful in that regard. And we want to continue having this with this group of very distinguished presenters. I think for me, I feel very lucky to have had the input from people who are so clearly closely associated with the response and closely following the response. And for the sake of both of our countries, we hope, number one, that everyone stays safe who is not just participating in this panel, but is listening to this event. That's the priority for all of us, and it should be going forward, but also looking to the future and what we can do to prepare both countries and both societies to work together to combat this kind of threat in the future. Thank you again, everyone who joined us. Thank you to Jane Harmon for participating and launching this event, and to, I think many people mentioned Paulo Sotero and for his leadership in helping put together this event. Even though he's not on the top of this panel, he certainly was here, both in terms of being in the audience and in terms of helping put this event together. We look forward to continued collaboration with all of the people on this call. Thank you again for participating, and look forward to further discussion.
Thank you.
Thank you.
Thank you.
Thank you so much.
Thank you. Goodbye.
Best of luck.
Bye.
Bye-bye.